name's Josie and I'm going to be your student nurse today. I'm just going to wash my hands real quick. And I put on gloves if we're dealing with any body fluids, but since we're not going to worry about that. So it looks like from the physician's orders, we have to do a heart, vascular, and abdomen assessment. Does that sound okay?
Yes.
Can you please verify your name and date of birth?
Jared Whitish, 051799.
Do you have any allergies?
No.
Okay, so that all looks to be charted correctly. So to start the assessment, I'm just going to ask you a couple of questions. Do you have any family history of heart attack or stroke?
No.
Any family history of aneurysms?
No.
And any family history of diabetes?
No.
Okay, perfect. So next what I'm going to do is I'm just going to look at your neck for any jugular distension, which I don't see. It all looks good there. Next I'm going to have you sit up straight and I'm just going to look at your chest, see if I can see any palpitations, which I shouldn't be and I can't, so that looks good. Next I'm going to feel your carotids. I'll feel them one at a time so we don't cut off any circulation. Okay. And those are good and equal. Next I'm going to feel your chest to feel the palpitations that we couldn't see. Okay, they're light blue there, so that's all good. Next we're going to listen to your carotids. I'm going to use the bell side of my stethoscope. Okay, so what I'm going to have you do is I'm going to have you look to the side and you're going to hold your breath. Ready? Hold your breath. Okay, breathe and turn to the other side and then hold your breath. Good, those sounded even. There wasn't any abnormality, no switching, anything like that, so that's good. Next, we are going to listen to the different, we're going to listen to different spots on your chest. I'm using the diaphragm part for this. So I'm going to have you sit up straight and we're going to locate the ankle of Louis, which is right here. We're going to go over to the side and this puts us in the second intercostal space and we're going to listen to the aortic with both the diaphragm and the bell portion of my stethoscope. Then we're going to go directly across and into the then listen to the pulmonic. Then we'll go down one space into Herb's point where you can hear both S1 and S2. And then we're going to go down to the apex. And lastly, we're just going to go over midclavicular to the tricuspid. Alright, all of that sounded good. No abnormalities, so that's good. The last part of this assessment is we're just going to listen, or we're going to feel all your peripheral pulses, okay? So we're going to start with your temporal pulses. And those are equal. We're going to move on to your carotid. We'll do them one at a time so we don't cut off any circulation. Good and equal. Next we're going to move on to your brachial, so I'm going to have you hyperextend. Do them one at a time. Okay. Alright, those are equal. Next we'll move on to your radials. And those are equal as well. Next we would do your femoral, which is right here, but we're not going to do that. So I'm going to have you roll up your pant legs just above your knee. We're going to do your popliteal. Alright, that one's good. And so that one and they're equal. Next I'm going to have you take off your shoe and your sock and we'll do your posterior tibial and then we'll do your dorsalis pedis. So posterior tibial is right here on the inside and then dorsalis pedis is right here. So you can put your sock back on and I'll do your other foot. On this, and then we'll move on to the next assessment. So we'll do your posterior tibial, good, and then your dorsalis pedis. Alright. Well, you get your shoes back on, I'll ask you questions for our abdomen assessment. So, do you have any family history of stomach cancer?
No.
Do you have any stomach ulcers?
No.
And do you have any constipation?
No.
Alright, perfect. So next what we're gonna do is I'm just gonna assess your chest, make sure it's symmetrical, there's no bulging, nothing like barrel chest, anything, that all looks good. So next what I'm gonna have you do is lay back and I'm going to listen to different parts of your chest. I'm gonna listen to your bowel sounds. And listen in each quadrant. Just listening for the popping or crackling sound, which I hear, so that's good. Perfect. Next, we're going to listen to some vascular sounds. We're going to start with the aortic. That one's loud and clear. Then we're going to move on to renal. And then iliac. Alright, those are all loud and clear. And the next what I'm going to do is I'm going to percuss the 4 quadrants on your abdomen. So it should sound like a hollow sound when I do that, which it did, so it's good. Next I'm going to just palpitate it. I'm going to go about 2 inches deep, feeling for any nodules, which I don't feel any. So that's good. And your skin color was good, the temperature was good, skin condition was good. Nothing abnormal about any of that, so everything looks to check out. So you can sit back up. And is there anything else I can do for you while I'm here?
No.
Alright, have a good day.